Have you ever found a friend or loved one unconscious? No, neither have I. But just in case this would ever happen, it is important to know how to take a pulse. Today, I will inform you how to properly take a pulse. My major is nursing, and I have had experience in the hospital by taking patients' vital signs. The first thing I was taught in the hospital by a nurse is how to take a pulse. By the end of this speech, you will know what a pulse is, where to find it, and how to find it. Let's begin with the first step. First, you must know what a pulse is. A pulse is a rhythmic throbbing of the arteries as blood is propelled through them. A healthy pulse is between 60 and 100 beats per minute. Knowledge about your pulse can help you monitor your current fitness level. Your pulse can be measured by counting the number of beats for a minute, or you could count for 15 seconds and multiply the number you got by 4. Now that I have informed you about what a pulse is, let's talk about how to take a pulse. The best places to find your pulse are the wrist, the inside of your elbow, and the inside of your neck. The pulse can be located anywhere an artery runs close to the surface of the skin. The second step is knowing how to correctly take a pulse and decide where at on the body you would like to take it. Today, I will be demonstrating the wrist, which is called the radial pulse. Make sure the patient is sitting down and relaxed before you take it. Have the patient's wrist on the anterior side, which is facing upward. Position your middle and index fingers so that they are touching to each other. Lay your fingers on the inside of the wrist below the base of your thumb, between the bone and the tendon, and then start reading it. I got 20 beats for 15 seconds. After you find the pulse, it is time to calculate it. Get the number you counted for 15 seconds, which is 20, and multiply 4, so that would be 80 beats. If the pulse is over 100, that means the patient is tachycardia, which means they have a fast heart rate. When the heart beats too rapidly, the blood flow is reduced. If the pulse is under 60, that means the patient is bradycardia, which means it is low heart rate. If your pulse is too low, it could be a sign of a health condition. Now that you have been informed of what a pulse is, how to take it, and how to calculate it, you should feel comfortable taking a pulse during an emergency or measuring your own pulse. Maybe one day you could even save a life by knowing how to take a pulse.